Good morning, folks. I see there's some guests starting to trickle in. We're just about a minute or two from starting. But for those who have joined already, welcome. Thank you so much for joining us. And wanted to share a couple features of the chat with you. There are two poll questions that have been posted. Would love to get your responses. You can post anonymously, of course, if you would like. We also have a Q&A feature. We'll be addressing questions at the end of the session, but you're able to access both the polls and the Q&A by clicking the 9 small dots on the bottom right of your browser or your mobile phone if you're on mobile. Take a look at the screenshots on the slide right here. That should help you out. But go ahead and click on that. And when you get a second, check out those polls. We'd love to hear what you think of not only about what you want to cover in today's session, but also a little trivia for you guys about the career and medical device industry. We're going to wait just another minute or two to let folks join, and then we will get started. Okay. It is 11:01, so we're going to get rolling here. For those who did not hear my earlier announcement, please take a look at the screen there. We appreciate you including your full name, so that way we can ensure to send you a recording of this or follow up with any questions that maybe did not go answered that you had. Everyone's muted by default, but we do want you to engage, please. So we have 2 polls. If you go to the bottom right of your screen, there are 9 dots. It says meeting tools. Go ahead and click polls and please give us your responses there. Curious to see what you hope to get out of this session, as well as a little trivia for you to get you thinking about the medical device industry and the space itself.
You said you gonna bring them what's the name back?
Appreciate that. And then also for the Q&A section, you want to click those 3 dots. You'll see Q&A and submit your question right there and just hit post and we will get to it towards the end of the session. But I believe we have our esteemed panel here, and I will then hand it over to Kim to kick things off.
Thank you, Michael, for the introduction, for the housekeeping items. Welcome. Thank you, everyone who has joined us or might be joining us here in a few moments for carving out some time in your Tuesday. My name is Kim Smalley. I'm the president of student operations here at Medical Sales College. I have had the really true privilege of partnering with this school for the last 13 years. And we have a very specific goal here at Medical Sales College. It is to work with professionals, probably exactly like those that are on this call today, in helping them navigate the field of medical sales, how to break in, what is it that you need, and not just breaking in, but how to be successful in the career that you land. I am a former surgical device rep myself. I actually started off in college thinking I wanted to be a dentist. Then I realized that the dental school, between the time and the financial commitment, maybe wasn't the right path for me, but I love dentistry so much and I love helping people that I decided to go into the sales side of healthcare. I was a dental rep for over 20 years before transitioning into orthopedic devices, starting my career with Zimmer Spine They've since spun off their spine division, but I was a spine rep for a number of years, and then moved into small bone reconstruction with a company called Integra Life Sciences. So I'm extremely passionate about the industry, the career, what it provides to individuals in the field, but I also recognize the extreme challenges or barriers that it takes to break in. So I'm hoping that in today's presentation will help you explore, learn more about the barriers and how you potentially can overcome them and you yourself enjoy a career in medical sales. Today I have two guests, and so I'm excited to welcome Connor Thompson and Matt Haggerty. Connor, I'll start with you if you don't mind. I'll have you just introduce yourself. We're going to have Connor on and Matt on a little bit later in the presentation, but maybe we can start out with an introduction.
Yeah, absolutely, Kim. Thank you so much for having me. Connor Thompson. I am the National Sales Manager with Icarus Medical Innovations. We are a medical device company based in Charlottesville, Virginia, focused on 3D printed braces. I've had the pleasure of working with MSC on a number of our current reps. I think 4 out of our sales team are MSC grads. So appreciate the partnership with MSC, and I'm excited to introduce a little bit about my world for you guys later on in the slide. So appreciate you guys attending and looking forward to getting more into DME with you all.
Awesome. Thank you, Connor. Appreciate it. Matt Haggerty, thanks for joining us as well. Would you mind taking some time, a moment, and share a little bit more about yourself and your background?
Sure, no problem. Thank you for the introduction, Cam. So Matt Haggerty, I am the Vice President of Sales for Crosslink Orthopedics, which is the largest distributor in the United States for Stryker, also the largest distributor in med device for spine and orthopedics. And so we're very proud down here in the Great South. We're based out of Atlanta, Georgia. My career has been a really, really good one that I'm very blessed to have been given opportunities. Started out as a associate on kind of ground level and in Massachusetts, and kind of worked my way up the chain through Stryker. So I was with Stryker for 13 years, worked in 3 different divisions of Stryker. So I have a lot of different background from trauma to joint replacement and also spine. So I could talk to a couple of different parts of the med device world. And then about 13 years ago, transitioned from Stryker corporate into this role with Crosslink as a distributor. So I can certainly talk a little bit about the differences between a corporate role and a distributorship type role. But we currently manage the divisions of spine, sports medicine, joint replacement, and trauma and extremities for Stryker in our footprint, which is North Carolina, South Carolina, Georgia, and a little bit of Florida. So pretty big swath of land, but very excited to be here. We take a lot of pride in helping folks get to a good spot in their career and helping develop and put them in a position to win. So always very excited to talk to a group of young, hungry, enthusiastic folks like yourself. So I'll hand it back over to you, Kim.
Awesome. Thank you, Matt. Thank you, Connor. This is a wealth of knowledge that we have here today, a lot of experience. So we'll tap back into both Connor and Matt here in a couple of moments. Agenda, so we have a road map of where we're going today, what we'll cover. For some joining us, this might be your very preliminary entry place of exploring a career in medical sales, figuring out if it's a good fit for you. Others, perhaps you have been on this journey for a while. And so I'm hoping that as we discuss and explore the different types of careers, it will broaden your horizon, maybe get you just more passionate about what you've always wanted to do. So we'll talk more about different types of careers that exist in the medical field. I do want to talk more about Medical Sales College and our place in helping professionals, again, not just break in, but ensure that they're going to be successful in the job that they land. So we'll talk a little bit more about Medical Sales College, what we do. And then lastly, internship opportunities. Again, Matt and Connor will be back on. We have some amazing partnerships with both Crosslink and Icarus. Again, giving individuals an opportunity to start careers with a foundation, a knowledge to be successful. So that's our agenda. With that, we'll keep moving on. So I'll let you just kind of lean into this slide just for a moment and read through the bullet points. I won't read through every single one of them, but there's always a why. For me, there was a why when I started my career out of college. I knew I wanted to do something that helped people. That's why I wanted to be a dentist. But I also knew that income potential was important to me. And so these are often the priority whys for you, for everyone looking to get into medical sales, whether it's I want to be in a place that I can make an incredible living. And medical sales reps do just that. While entry level may not be a six-figure career, being a medical sales professional does lead you to an opportunity for a six-figure income. Again, helping people. There are a lot of, we'll call them jobs, careers, that perhaps you're not making the impact that you desire, and you really want to leave every day knowing I made a difference in someone's life. And so medical sales is going to provide that opportunity. Also, there are industries that are highly impacted by our economic times. We may know some of them right now. If you happen to be coming from maybe the mortgage industry or real estate, it's tough. The thing with medical sales, it is going to continue to grow as one of our leading drivers on the need for healthcare is often our aging population. It's our baby boomers. And so we know that this is a field and industry that's going to provide an immense amount of security and stability for you. Innovative technology, right? When I was in the field, robotics were really just coming out. Now robotic assisted surgery is very commonplace. And so we're working on products that have lower blood loss, or they have a quicker implantation or speed to recovery. So advancements in technology are always part of the medical sales industry. You also want to be a consultant. Some sales, it's a singular interaction. You don't have a long-term or ongoing relationship. In medical sales, I will tell you, and I'm sure Matt and Connor will attest to this, you are the surgeons, the physicians, the hospital's consultant. They rely heavily on you and your expertise for positive surgical outcomes or non-surgical outcomes. But also, perhaps you don't want to go to the same brick and mortar building every day. And so medical sales is very diverse in the day-to-day activities, not often the typical 9 to 5. And so often, and I guess I did read every single one of those bullet points. That's how passionate I am about it. But hopefully you're looking at the list and identifying, potentially what is your why of wanting to get into medical sales. All right, as promised, I'll talk a little bit more about medical sales or medical sales college. Here's often, for those that have been exploring this, potentially applying or even interviewed for opportunities, it takes two things. It takes what you know. The most ideal candidate for any job, certainly a medical sales job, is the one that has the most relevant experience. How much do you know about the procedure, the pathology, the device, the ability to read an x-ray film, the ability to engage with a physician or a surgeon? Many times what happens is the candidate is missing the mark and they don't have enough relevant experience. Everyone has experience, regardless of what your background is, but how much of your background is going to be directly related to the job of which you wish to fill? I call it speed to impact. How quickly can a company onboard you and you can be a beneficial player to the team? So through Medical Sales College, we offer a number of different programs that provide you just that relevant experience that you can then demonstrate to an employer that you can come in and more immediately hit the ground running. We have a biologics and regenerative medicine program. It's actually one of the fastest growing areas of medical sales. For those who may not be too familiar with what a biologic is a product that's used to regenerate or grow. So we have the ability to regenerate our bones, tissue, tendons, skin, nerve, skin graft material, something I usually say it resonates with individuals. This particular program is going to teach all facets of biologic products. We have a total ortho hybrid program. Hybrid meaning there's going to be a component that is virtual and online, and then a smaller component that is on campus. Total ortho hybrid is, again, the hybrid component. It's 9 weeks at home. It's 5 days in our Atlanta campus, and we're covering all of our orthopedic disciplines from spine, sports medicine, which is surgical repair of the joint, total joint arthroplasty, your joint replacement, trauma, and extremity small bone reconstruction. Our last program is an all on campus. So for learners who want to be on campus with industry professionals on a regular basis for 10 weeks, it's our Total Ortho Plus. We do cover those same orthopedic specialty disciplines, but a lot more hands-on, a lot more mentorship, a lot more sales. If you want to make sure you're getting the most robust sales training, our Total Ortho Plus program offers that. Again, it's a 10-week on campus, and we do have 12 campus locations across the United States where we offer our programs. You know, the other component of what we do is the industry contacts. It's about what you know, but it's equally about who you know. And again, certainly honored to have Matt and Connor as partners in recognizing what we do, the value that our graduates can bring to their organizations. Again, 15 years, December, my apologies, December will be 15 years that we've been a licensed and regulated college. We are the only licensed and regulated college in the US. We are approaching that 5,000 mark of professionals that we have helped enter successful careers in the industry. And overall, we're exceptionally good at what we do. More than 8 out of 10 of those we train land jobs in some form of medical sales. So hopefully that was a little background on Medical Sales College. I want to talk about 2 different paths, and as each of you are exploring your path, you may resonate with one more than another, drawn to one. So I'll just speak to them a high level, and then we'll have Connor and Matt jump back in. Surgical is just that. Surgical sales rep is an individual who will be joining their surgeon in the operating room. While we are not sterile or scrubbed in, we are in the OR as a subject matter expert, there if necessary to walk our surgeon through how to implant our product. In the event that they would get into a form of trouble, we're there to assist them. So a surgical sales rep is a very important component of a successful surgical procedure. So surgical device rep, you're going to be present in the operating room. The OR may not be a place where you see yourself, and that is fine because there are a plethora of jobs that are outside of the operating room. Those are your non-surgical. Again, Connor is going to speak to that a little bit more as a non-surgical. I started in non-surgical and dental. So there's dental, there's potentially urology, there's disposables. Every facility across the US uses some form of disposable item, whether it's a glove, a gown, a mask, a needle. And so your non-surgical can be disposables, consumable items, can be our DME, sometimes can be our capital equipment. So those are the 2 different paths as you are thinking ahead on where you would find maybe the most success or enjoyment. You might consider, again, surgical or non-surgical. All right, Matt, you're up. I'm going to have you speak regarding surgical, and I'm sure you can bring some more breadth to the surgical device rep role.
Yeah, happy to do that. So yeah, it's kind of interesting. Similar to Kim, I've had experience on kind of both sides of the house with surgical, non-surgical. Obviously, being in the operating room is a very fun and exciting way to enter this career path. And I think the big differences that I've seen are a couple. Number one, when you're in the operating room, obviously you're part of a team. It's kind of where your home base is. And it's kind of an interesting thing to think about. You join a corporation and you work for a company like Stryker or something like that, one of the companies that has surgical devices. And really, like, that's your team. But when you start getting into the flow of the business, the day-to-day operating room business, what you realize is your team actually becomes the OR staff, the surgeons, the folks that you interact with day-to-day to really take care of patients. And me personally, that was a very exciting place to be. That was a place that I really found my roots in medical sales. And what you find is a couple things. Number one, it's very service oriented. So this thought process of selling is really a part of the process, the overall process of being an adjunct to the surgical staff, to the surgeons, to the administration of the hospital or surgery center. And what you realize is that you're not there just to sell a product. You're there to provide a service, and that at the center of that service is the technology that you sell. And so those things, I think, very important to understand, because it does kind of drive your day and your experience. And what you find is in a medical device job, whether you're selling a spine implant or a total knee or total hip product, or even a trauma product where you're coming in the middle of the night to help a patient out that's been in a car accident or something along those lines. When you're in the operating room, you're really part of the team that are taking care of that patient. And those things kind of happen at whatever time that the operating room team schedules them. So whether it's elective procedure, as an example, total hip or total knee, as typically something that is booked out months in advance, or it's something that is very emergent. A lot of the trauma procedures, as an example, you break your leg or you get in a car accident, that's not scheduled. And so one of those things that you realize as being an operating room med device rep is that you're kind of on everybody else's timeline. You're on everybody else's schedule, and you're there to basically support the staff, support the team, support the surgeons. And I get a lot of questions around this for people that are outside of industry is, well, how does that work? What is my role in that process is? And my explanation of that is pretty straightforward. Your role is to make sure, number one, that the products that you represent are there, sterile, ready to go when the surgeon needs them, and that you are very, very knowledgeable about the use of those products, so that you can answer questions, so you can help staff set up things appropriately, and so that you can make sure that the surgery goes as smooth as possible, at least for your portion of the surgery, that it goes as smooth as possible. And so there's a lot of pieces that are involved in that, but as an overall kind of overarching, my thought process in terms of differentiating an operating room position versus a non-surgical position is really kind of highlighted in those couple things. So Kim, hopefully that gives a pretty good overview for your team, and I'm happy to answer any questions about that.
Matt, that was perfect. Thank you. Thank you. And I'm confident we will have some questions that we'll address at the end or answer at the end. So, but thank you very much. Love it. Love it. All right. Cotter, you're up. You're our expert here in this arena. So I'll turn it over to you.
Yeah, thank you, Kim. So durable medical equipment is kind of the world I live with, and it's not the OR like Matt just described. The main difference here is when the product is going to be used, right? So durable medical equipment, it's really an item that's prescribed by your healthcare provider for repeated or long-term use to manage a medical condition or illness or injury for that patient. Typically, they are external, right? So you have some examples here: wheelchairs, walkers, canes, scooters. These are all examples of durable medical equipment, not as glamorous or exciting as the world that I live with at Icarus, where we specialize in braces, knee braces, foot and ankle braces. Ultimately, these are external products or devices that are used by patients in their day-to-day life, right? So these are going to be items that are used or worn by a patient to improve their quality of life. That the main difference between the OR and DME is really, your office, right? Matt just did a good explanation of the OR. You're going to be in that operating room, supporting the staff and helping with that surgery. Your office in the DME world is oftentimes your car driving between offices, right? You're going to be working with and selling to a lot of the same people that the surgical the surgical channel works with, you're just going to be working for those patients either before the surgery or after the surgery, right? So in our worlds with knee braces, for example, you would be helping get a patient a device or a brace to improve their quality of life before they have that surgery, or a knee brace to help after that surgery occurs, right? So you're not going to be in the OR, but you're still going to be helping those same patients. The patient's aspect of DME is very important. As the slide notes, you will be working directly with patients. So that's important for this role. I find that reps that thrive in the DME space have, Kim mentioned the why. A lot of the times the reason reps are in DME is to help patients improve their quality of life. DME can help with that, and it's important to have that patient first mindset if you're going into DME. The cool part in my eyes for the non-operative role is, the surgery isn't for everybody, right? Some people don't like to see, the insides. You'll learn that by going through MSC and going through the process, but you can still help patients and improve their quality of life through DME. I enjoy working with surgeons, working with their staffs, as Matt describes. You're not just selling to the doctor, you're really selling a solution for that office, for that hospital, for that group. You're selling a service for their patients. This slide notes it. The industry is growing. It is going to be 83 billion by 2028 and over 100 billion moving forward. So there is a lot of potential in the DME space for career trajectory and career growth. You can see over 6,000 companies in the space, and that number is growing. I will say, Matt mentioned some definite similarities between the two. The one I would note the most is the consultative selling. You're not just selling, a commodity. You're being a resource for that surgeon or for that group. Using your expertise to educate and provide the best options for those patients. So that's the general overview of DME, durable medical equipment. The main takeaway I would say is, the difference between DME or non-surgical versus a surgical application is, where your office is and, how the devices are used, right? DME is going to be, extended throughout that patient's life. So you're making an impact, not just on that surgery day, but improving their quality of life into the future.
Thank you, Connor. And I think great job of tying the number of similarities between a surgical device rep and a DME rep, because they all have an ability to help people. It's growing industry. You're making a difference. People get better because of your product and technology. You're building relationships. Our hospitals, our surgeons rely on each of the reps in these fields. So thank you very much. That was very informative, very helpful. All right. So I wasn't sure, Connor, if you wanted to speak to any of these. Again, I think that we see a very broad scope of where your products can be used. Yeah.
I'll quickly highlight Icarus. So, DME is a very wide category, right? Here at Icarus, we focus on more of a segment of the larger DME category, and this is bracing, typically orthopedic bracing. What's different about Icarus is how we kind of come at that challenge, right? So we actually are deeply rooted in technology. We specialize in custom fabricated devices made specifically for an individual patient, right? So we're based in technology. We use an app for the iPhone to take a scan of that patient's limb, and we use that scan to make a 100% custom fabricated brace. My leg is different than Kim's leg. You need a different brace to fit your specific diagnosis. So we utilize technology. We also manufacture using 3D printing, which is an emerging technology. It allows the device to be very lightweight and actually, turned around quickly for those individual patients. So you can see here our flagship product, the Ascender knee brace. Its original intent was for osteoarthritis, but this device can be utilized in a number of applications, preoperative, postoperative, from a rehabilitative standpoint. It can be used for sports, skiing, snowboarding, pickleball, some of the main ones we see. But our main focus is on that osteoarthritis. The cool thing, and I'm totally biased here with Icarus specifically, is 5 years ago we were a single product company focused on just the Ascender. Today we have over 8 products and more in the pipeline, which allow you as a sales rep to open up many more doors, right? So not only do we offer 3 different types of knee braces where you can talk to doctors in the non-surgical standpoint, orthopedic surgeons, post-operative standpoint, we are now into the foot and ankle space, the knee, ankle, foot orthosis space, and we have some new products in the pipeline as well. So very unique, disruptive technology in the orthopedic bracing space. Really tied to technology. That's what makes us different. The benefit of our product is it's totally unique and different, and doctors want to hear of new technology, right? Specifically in the bracing world, not much has changed in the last 20, 30 years. So when you come with a new innovative technology, that gains some attention. And you're also, we're addressing diagnoses or patients with conditions or issues that really there are no other solutions for. So as a sales rep, that's exciting. You're not just selling, another product that they've seen 100 times. And when you have something really new, innovative, and disruptive, that gets attention, and that makes it fun. A little bit more about the team itself. As I mentioned before, we've had a lot of success with MSC. I think 4 of our 14 national reps currently, so about a third of our team is directly from MSC. So, you can certainly see yourself transitioning into a role with Icarus because we've had success with it in the past. A little bit about our structure itself, and then diving into the internship. We're looking for growth, right? We currently have 14 reps covering the country. This time next year, we're looking to double the team. So there are plenty of opportunities for reps like yourselves to break into the industry and join a rapidly growing company and really gain lots of good experience. And I think one difference between potential opportunities with Icarus, we're looking for reps to cover large territories, right? So lots of opportunity to cover an entire state rather than some other DME jobs. You might be focused on one hospital or one clinic, right? We're looking for reps to cover lots of real estate and cover a whole state. So that's a little bit about Icarus. I'm excited for this internship partnership with MSC. A little bit about who we're looking for. We're looking for candidates coming out of the Total Ortho Plus program. So that on-campus 10-week program. We would follow that 10 weeks with a 4-week internship here at Icarus headquarters in Charlottesville, Virginia. It would be an immersive 4 weeks where, you would be learning alongside, my current sales team on the products, the space, and, how to sell DME or knee braces. Requirement wise, we're looking for a bachelor's degree in that Total Ortho Plus program. These bullet points, areas to relocate, like I mentioned, we're looking to fill lots of opportunities. Here's just a handful of these. We're looking for hungry individuals that are willing to learn and grow with the company and have flexibility to relocate where that demand requires. I will tell you a little bit before talking about the benefits. Who is this opportunity for? We're looking for hardworking individuals who are competitive, with a business mindset, but also a patient first or a patient care mindset. I'm glad Kim mentioned it on her first slide, but knowing your why is important. Being passionate about sales, being passionate about making money is great, but also being passionate about, building relationships with your customers, but being passionate about helping people, having those positive patient outcomes. We're looking for candidates that are deeply rooted in that patient outcome. Benefits of this program, there is a 50% scholarship for the Total Ortho Plus. We offer, a stipend for the 4 weeks at our facility. We put you up in housing, and you're fully immersed with the team here in Charlottesville. So it's hands-on. There will be some classroom, but we're going to get you into the field. We're going to get you in front of accounts. We're going to have you talking to our customers and really getting you some true hands-on experience. The right candidate would receive a letter of intent, and, there are definitely some perks to joining a, young growing company, including equity opportunities and some bonus options as, you progress with your time here at Icarus. So, excited to officially launch this and looking forward to talking to some of you candidates, hopefully on this call here today.
Awesome. Thank you, Connor. And, I appreciate you reiterating, the importance of having individuals that are coming into their positions with the foundation, right? Able to be more immediately impactful for your organization. And I also appreciate you circling it back to the why. I can tell you every time that we have an ability to help people, and that should be the premise of our goal in medical sales, is to help people. I think I probably should put that. Then the money comes, right? When we're able to help people and make a difference, the money does come. So awesome. Thank you very much. Matt, I put you back up so you can talk more about CrossLink's fellowship opportunity.
Absolutely. So I'm going to take a similar route as Connor. Number one, Connor, great job. I actually had my son had a brace from a sports injury that was 3D scanned and printed. It was a very cool process. So neat technology for sure.
Yeah.
So for CrossLink, and again, we put a heavy focus on our relationship with Stryker. So from a technology standpoint, you're going to hear a lot of similarities between myself and Connor, right? We are very much a technology company, very technology driven. Our technology really focuses on the operating room and the implant side of the business. So I'm going to take that in a couple of different paths, but first and foremost, you think about implants, you think about spine. I know Kim had done that for a while. You think about sports medicine, you think about trauma and extremities, and certainly joint replacement. The significant difference of what we used to do 25 years ago when I started in this business versus what we do today is it's almost staggering. The acceleration of technology, and probably best represented in the last couple of years in robotics. And so for us, when you think about total hip or total knee replacement, 15 years ago, all of those products were put in manually by the surgeon. And now over 60% of those products are now put in with using a robot, which is exceptional. And the outcomes and the reproducibility of that is a big difference. And so for us, as we talk through our products and kind of what we do day to day, a lot of that is technology driven. But in the operating room, and like we talked about before, with our responsibility and being able to really be a consultant in these surgeries. And when I say being a consultant in surgeries, our top reps, when they're in the operating room, they have a very close relationship. They're with that surgeon 2 or 3 days a week, helping their team drive good patient outcomes. And when we talk about consultative discussions and what that relationship looks like in the operating room, our reps are dressed out, they're in scrubs, and they're at the back table, and surgeons will turn around to them and say, "Hey, what do you think about what we should do today? What do you think about this x-ray? What do you think about how much should we take in our cut off the back of the tibia for this total knee?" And you're supposed to come up with a really good answer to that question. It's something that's going to help them make decisions and make sure that patient's experience and the outcome of that patient to be able to get back to work to get back to their home, to get back to their family, to get back to their day-to-day living, is a positive one. And so it's a massive responsibility. And when we talk about the why, we have an opportunity to see these patients afterwards, to especially with some of the patients that have really complex injuries or really difficult scenarios, and we get them back to their families, back to their jobs, back to their lives. It's an incredibly gratifying thing to do. So, again, go back to the why that Kim and Connor both outlined. For us, that's a big part of our why. As it relates to the technology, and you can just think about all these different procedures and the technology that goes into it, it takes quite a bit of time to learn these products, because we not only have to know how to navigate the hospital, how to navigate the sales cycle, and how to present these products in the right way, but in the operating room, we are the technical experts in these. So we need to learn the anatomy. We need to learn all the different terminology around that, and then most certainly around the technology, all the ins and outs, all the details, because despite best efforts, sometimes things don't go exactly as planned in the operating room. And so to be able to manage that on the fly, be able to come up with good solutions and be basically a solutions provider for the team is extremely important. And so that kind of leads into the discussion around the fellowship. So if you're interested, and like Connor said, we've had the experience of hiring a lot of people and training a lot of people over the years, and we've had multiple medical sales college graduates come into our team and have done very well. And so coming through this experience and having this partnership with Medical Sales College, really our thought process for people that want to be in the operating room, that see themselves in a sales role where they are directly involved with the patient care and working with the technology in the operating room. The gap between starting a role like that and getting to be very proficient, that is the part that is the most challenging. And I'll tell anybody that wants to get into this career that it is a constant learning process. 25 years in, I'm learning things literally every day. And so what we try to do with this program, with our Crosslink Fellowship, is really the thought process around that. If you haven't been around surgeons, they go through their residency programs, and then anybody that wants to specialize goes to do a fellowship as a surgeon. And so we decided to coin our opportunity as a Crosslink Fellowship because it's really specifically for anybody that goes to the Ortho Plus program and really wants to subspecialize and become very, very good in the field of either joint replacement or trauma and extremity, to join our team and basically get a very in-depth 1-month program that takes you through all those details about the terminology, certainly the anatomy, the products, the procedures, and then get a very hands-on experience with that, with the thought process that at the end of that fellowship to be hired by the Crosslink team to then go into the field and join one of our teams within either North Carolina, South Carolina, or Georgia. So our fellowship, the curriculum is based on a combination of didactic, where we're in a classroom type setting, where we then go into a kind of mock OR setting where we have sawbones and even work with surgeons on a cadaver. And then the last portion of that program is where you actually will go and shadow our best sales reps in Atlanta and spend time in the operating room seeing both robotic and manual or non-robotic procedures being done on the joint replacement side. And then also going, if you decide to go in the route of trauma and extremity, to actually going into our trauma centers with our best reps and top surgeons in Atlanta and basically fixing folks that have had very traumatic injuries. So incredibly exciting, very interesting in terms of the structure of this program. And what we have really thought through this process is this is an accelerator program. And that's, again, why we use the word fellowship, because this is, our program is designed, we are only taking 2 people per quarter. Our sales team is made up of over 200 sales reps. So we have a lot of sales reps in a much more condensed area. Very different than the opportunity with Connor's team. But that's the way that the structure works in the operating room. You're really focused on just a handful of hospitals, a handful of geography, and the thought process is that you get really, really deep with those customers. You get really deep with the technology, and you're their day-to-day person to make sure they're having the best outcomes for their patients. And so for the fellowship, we host this in Atlanta, Georgia. That's where our headquarters is. When you come, you have a stipend that's involved that helps manage your expenses. You also have full exposure to our entire executive team, which is honestly a great experience to kind of get a well-rounded view of not only the role, but also the team with CrossLink. And then, with the program, our thought process is we're looking for really the best of the best that want to get into the operating room. And so we have pretty high criteria that we worked with at Medical Sales College, that you have to be a top performer in their class. And then you also have to go through multiple rounds of interviews, because when we accept people into the fellowship, that is an offer to join the CrossLink team. So when people get offered the fellowship, that will be paired with a long-term employment opportunity with the CrossLink team to either be in the specialty of joint replacement or into the specialty of trauma and extremities. So in a nutshell, great opportunity, great experience, lots of hands-on, but I'll kind of echo what Connor said. It has to be for the right person. You have to be very flexible in your approach, in terms of your geography, in terms of exactly what the process is to get from point A to point B. Because my experience in doing this for a long time, and also mentoring people through this process, is you have to be very, very persistent. You have to be very focused on the fact that you're going to grind at this for a long time to get to where you want to go. And that you have to be very willing to be flexible to really where the best opportunities are. And sometimes that may not be in the geography that you necessarily see yourself being, or you have family or that sort of thing. A lot of times it has to be, much like Connor said, you have to be willing to kind of get outside your comfort zone. And if you want an opportunity like this, that you have to be willing to kind of chase that opportunity down. But this program is specifically designed for people that want to do that, and specifically designed for people that are flexible to get into the right role in the right spot, and have an acceleration in their career. So, Kim, I'll hand it back over to you.
Wonderful. Thank you, Matt. Thank you, Connor, for supporting the vision of Medical Sales College, and looking at those that are coming to you with a foundation and a commitment to a successful career in this industry. And I am so confident that a student who goes through a program here at Medical Sales College has more of the relevant experience that's going to allow them to join CrossLink, join Icarus, and be more immediately impactful. So thank you so much. All right. So next steps in the process. I am hopeful that this was very informative. It allowed you to not only learn more, but perhaps make some decisions on your next step, what you're looking to do. So there will be an email follow-up. So hopefully everyone was a good steward and put their name in the webinar so we can correspond with you. I'm also going to make life super easy. The next slide, which we won't go to yet, but we'll have a QR code. This is kind of the point to decide what resonates with you. Where do you see yourself being successful? What do you want to explore? And so you'll have an opportunity to then select which of these internship or fellowship most closely match what you're looking to do. So there will be a QR code. There will also be a follow-up email. What we ask is that you submit your application identifying what your level of interest is, whether it is Icarus, CrossLink. And there are occasions, and why we put this on here, there are some who perhaps neither one of these fit best for what they're looking for, whether it's geography, it doesn't matter. But we're always happy to speak directly to those who their option is just to attend a program without a fellowship or internship opportunity. So that's an option on this application as well. Once the application is received here, it will be reviewed. Selected candidates will receive a follow-up email. So please, please, please do me a favor. Make sure you're watching your emails. You don't let them slip through the crack. Check junk and spam. The next step is to submit a video, a 1-minute video of what is going to make you the most ideal candidate for Icarus or Crosslink. And then from there, one-on-one interviews will follow. That's the next step in the process. If we can put up the QR code, beautiful. Thank you, thank you. For those that want to get to it as quickly as possible, here's the QR code. We'll follow up with an email as well with the application link. And again, this is your opportunity to select which of the Icarus internship, Crosslink fellowship, or student enrollment is going to best fit what you're looking to accomplish. All right.
And folks, thank you. Hi, Kim. Sorry, just chiming in here. I know we've gone a little over here, but we do have some questions. So hoping that the panel could address these. I'll go ahead and read them out to y'all. And for those of you still with us, if you do have a pressing question or something in the back of your mind that you haven't submitted, it's not every day you're going to have a panel of folks with this level of expertise, experience, and success. So not everyone has this opportunity at this phase in their journey. So if you got a question, please share it with the panel. But with that, I think we addressed this already, but if you want to just summarize very quickly prerequisites for the field as well as each opportunity at a high level, each of the industry internship opportunities.
Michael, was that for Cutter me? Sorry, Cutter.
Yeah, I'll just say for ours, I mean the prerequisites for the course itself, obviously we're looking for the Total Ortho Plus. Maybe not prerequisites, but the candidates I'm looking for are, hardworking, business mindset, patient first, with a keen sense of problem solving quickly on their feet, coming up with creative problem solving solutions quickly. So that's the type of person I'm looking for.
Yeah, would you like me to jump in as well, Michael?
Sure, Matt. Yeah, just if you could summarize for Crosslink.
Yeah, sure. So very similar in terms of the kind of the person that we're looking for. A lot of similar things that Connor says. We're looking for somebody who's highly competitive, that definitely sees themselves in the operating room. But I think for the fellowship, we have a pretty high criteria. So we would have to be somebody that goes through the Total Ortho Plus program, and it would have to be somebody who scores very, very well on that. We have a whole criteria around that, but somebody who's a top in their class. And then past that, certainly the criteria being able to move to Atlanta, be a part of the program, and have interest to accept a position after the fellowship in our 3-state footprint.
Great. Thank you. And I guess kind of segueing into the next question, Matt, what you just mentioned, the question is, would moving to, for example, Georgia only be required for the 4 weeks during the Crosslink Fellowship, or also for the full-time position? And what locations are there for full-time positions at Crosslink?
Yeah, great question. Yeah, so the fellowship is hosted in Atlanta. So you have to move to Atlanta for those 4 weeks. And then post-fellowship, upon graduation, you'll be offered a position within our 3-state footprint. Obviously, forecasting that we have roles in North Carolina, South Carolina, and Georgia currently. And anybody who gets accepted into the fellowship is guaranteed a position with Crosslink long-term. Forecasting exactly where those positions are now, it really is dependent on where the best fit is and where we think you're going to do really well. So hopefully that answers your question, Michael.
That was great. Thank you. Yeah. So we're getting variations on kind of the same question here, essentially asking if, there's an internship with just MSC, or can we go straight to Crosslink or Icarus with an internship and not do a program? So Kim, I don't know if you want to start off with that one, but it did come up a few times, and kind of just highlighting what opportunities are available, and also kind of how this has been structured with both MSC, Total Ortho Plus, and the industry partner, and why we feel it's important to have that combination.
Absolutely. Thank you, Michael. I did see some of the questions come in as well. Both Icarus and Crosslink, certainly they see the value of having someone who has been trained, has a foundation, able to join their organizations and be more immediately impactful. So with both of these opportunities with CrossLink and ICRIS, it does require the individual to attend a Total Ortho Plus program first. And it can be at any campus location. So we have 12 campus locations throughout the US. So where one takes the Total Ortho Plus program, really, it doesn't matter, whatever's convenient for you, but just knowing, where your internship or fellowship would be, Charlottesville, Virginia, or Atlanta, Georgia, and then with potential relocation as well. Does MSC offer internships? Medical Sales College does have some internship opportunities that are available, and so certainly can address those as well. And Michael, if you want me to do it now, I can talk about those, or we can really kind of focus on the CrossLink and ICRIS.
Yeah, I think so. For that particular question, everyone will have a career advisor assigned as a follow-up, and we can go into a little more detail on some of those particulars. But I think it's just important. Thank you for highlighting the reason this is structured the way it is, because I mean, it's a very competitive landscape, and you're fast tracking into it an amazing opportunity. If you are privileged enough to be selected for one of these internships. I think that's most of them. If we didn't get to one, we'll follow up. As a reminder for everyone, this has been recorded and will be shared with you after the call, as well as more information and the links to apply if you didn't get it here today. If you have any follow-up questions for the panel, you can email us back and we will route those to the panel. And Kim, I'll invite you to just wrap it up, and thank you to our panel and thank you to all our guests.
All right, Michael, thank you for helping moderate. Connor and Matt, thank you for contributing, sharing more about your organizations, but also I'm sure everyone felt the passion for what you do, what we do as medical sales professionals. So thank you for carving out your time to share about these great, amazing opportunities, but also your organization and yourselves.
Happy to do it.
Absolutely. Thank you for having us, and best of luck to everybody. If CrossLink or ICRIS isn't your final stop, I wish you all luck on your medical sales journey.
Thank you.
Yeah, I think from my side, I couldn't agree more. And for anybody that's looking at this career path, agree with Kim's comments. Medical Sales College does a great job preparing people for this field and putting them on a path where they can accelerate their career. And we really see this fellowship as an extension to that. So if this is something you're really interested in, this is a great avenue and pathway to kind of get to that endpoint that you're looking for. But very excited for the partnership and appreciate being on today.
Thank you, Matt.
So.
All right, thanks everyone once again. That'll conclude